years now. And currently I'm the chair of the Vasco da Gama movement, which is a European network for the residents and the young general practitioners and family physicians within Wonca Europe.
So I'm Naomi from Australia. I work in Melbourne and I also am an academic, so lecture at Monash University, and I founded the Raja Kumar movement in Asia Pacific region.
Hi, I'm Karina Villarroel. I'm from Chile. I'm a medical doctor since last year and I represent the Wonca movement.
Hello, I am Dr. Raman Kumar and I am working in New Delhi, India, and I've done my residency training in family medicine. I am one of the first generation residency trained family physicians in India. We had generations of GPs who were not residency trained, but recently this development has started, which is residency training in family medicine, which has started, and it is gaining momentum. And we are trying to push hard, and it's becoming very, very popular gradually. Because once people are trying to, once they know about it, once you know about it, you are into it. And it's something which relates you to your people, your communities. And this is what inspired me to join family medicine.
The Gama actually borrowed the name from the great explorer that discovered the route towards India, because we believe that that would be an appropriate name as we are young people and we are trying to find our own routes towards a better primary care, a better general practice. We have we actually function as a communication platform, bringing together experiences, business dreams from all over Europe, and we try to build strong bonds between the countries and between different think groups and peer groups.
So the Raja Kumar movement is for young and training doctors in family medicine. We are slowly developing through mainly social media, and we're having pre-conferences at each regional conference and co-hosting world pre-conferences.
Wonca is a movement of young family doctors and residents of Ibero-America. We have now 12 countries participating in Wonca.
Okay. I'm here in Prague to represent a very special movement called Spice Route Movement, which is a forum for young doctors from South Asia region. We represent young doctors, medical students and interns, house physicians from Nepal, India, Pakistan, Afghanistan, Sri Lanka, Bangladesh, and we collaborate very often. We started our movement in 2010 in Nepal, Kathmandu, and we had our first pre-conference in Mumbai, which was attended by some 70 young doctors from South Asia. And then we recently, in April this year, we had a very strong presence of young doctors at First National Conference of Family Medicine, New Delhi, which was also attended by one of very esteemed doctor from South Africa, Bob Mash. And he really contributed to our movement, and he participated wholeheartedly, and he went us with the government officials, policy makers, and South African model of family medicine is something we are also looking forward to learn from. And there is a lot of things to learn from each other, because India is part very developed, part is very much like underdeveloped, and I think many parts of Africa are like India. So there is a lot of things I think we can learn from each other, and we learn only when we come together. So coming together is success, and it's very important that we support and participate in the activities related to family medicine. Family medicine is the future of healthcare of the world.
British Museum had lost its charm. How long I wondered, could this thing last? The age of miracles had at last, and suddenly I saw you there, and in foggy London town the sun was shining everywhere.
My name is Alao Kayode. I'm a family physician from Nigeria. I practice at the North Central region of Nigeria, Federal Medical Center, Kefi. I hold a fellowship of the West African College of Physicians in Family Medicine. I qualified 3 years ago. I'm married. I have 3 children.
Well, Oteju Aramide. I'm a family medicine resident, a senior resident in Lagos, Nigeria.
Hello, my name is Magdalena. I'm a family physician. I work in South Africa. I originate from Bulgaria. I did my undergraduate study in Bulgaria and postgraduate study in Wits University in Johannesburg.
Hello, my name is Abakunle Oluwatosin. I'm a resident doctor and I train in the southwestern part of Nigeria. I work in Wonca University Teaching Hospital in Ife. I had my undergraduate training in the University College Hospital, University in Ibadan, Oyo State. It's also southwestern part of Nigeria.
I'm Mr. Fato Honore, medical doctor from Benin Republic. I graduate for general practice in Benin and I am married with 2 kids. So I'm president of an international organization, Tree of Life, and I'm finishing my general practice training and family medicine training nearby in Germany, also in rheumatology, orthopedic and physiotherapy.
My name is Sam Obabogo. I'm coming from South Africa, Johannesburg, under Wits, University of Wits Witwatersrand, Department of Family Medicine. I'm here in Prague for the conference. One of the South African delegates, and I'm here to represent South Africa as well under the Afriwon, the newborn Afriwon Renaissance, which is a new organization for the youths in GPs and family physicians, newly graduated family physicians. We expect that it's an opportunity for us to get around our other colleagues.
That's a great question. Africa has a lot of challenges generally. Then talking about challenges of family medicine and training in Africa, especially for the young ones. One is faced daily with a load of patients, then with little resources for you to care for those patients. That is in the practice. Then in training, there are a lot of issues in Africa generally. Facilities are there, they are not being utilized or being maintained to ensure that young physicians achieve their full potentials. Then in addition to that too, challenges in Africa will be an African nation not knowing what the other neighbor is doing and moving across borders has become an issue. It affects training of young physicians and practice generally in Africa. Those are the basic challenges.
As a young family physician, I think one of the major challenges that we face in Nigeria is lack of facilities. There is the lack of facilities to be able to do a lot of what we need to do. Poor technology, infrastructures, basic things, water, electricity, and then funding. A lot of us have to put ourselves through school, and then of course the remuneration to even be able to do these things, to study. Sometimes you find people in residency and also doing private practice at the same time just to try and make ends meet with their families. Then even for young family physicians as well, a lot of people that want to do the program also find it difficult to get in because there are not enough spaces. So you see people struggling for the positions at home. Then of course getting into school again, having to read for exams, and like I said, could be all of those things. What are the challenges we face?
What is my challenges as a family physician is to be able to do the multitask between my own family and patients' families and their own needs.
Most daunting challenge as a young family physician is that of infrastructure, being able to see patients and work with them, make a clinical diagnosis, and being able to help them to logical conclusion, because sometimes things you need to help people are not in place. But as a family physician, one of the tenets of family medicine is being innovative, so we find ways around those, and that takes a lot from us. Also, another challenge is balancing clinical work with academics and research, which are things that have to go hand in hand. We shouldn't just face clinical work alone. So many of us young family physicians face this challenge, so we have to find a way to strike a balance between our clinical work, discharging our clinical duties, and academic advancement and research.
In Africa, Benin, where I know it well, it is to bring the colleague together behind the vision, what I have seen here, create structure and model. The way we are doing, the way we must do it, and how we must do it will be my challenge.
Yeah, we've got lots of them, and I'm sure that's a forum for us to share those challenges. Most importantly, I think issues around being recognized, trying to make an impact in the society, and also as well issues around finance. Coming to conferences like this to update ourselves is so important, and also know what's going on with the other colleagues in other continents as well.
Afriwon, a great group. It has come to unite Africans, young family physicians in Africa. We think getting everybody together, membership, getting all the nations we hardly hear anything about, will be the first thing to do, and we hope in the next 1 or 2 years or so we'll be able to achieve having a large number of African countries coming together and about the Afriwon Renaissance Group. In addition to that, we don't want to stand in isolation to be covered by the clouds, the dark clouds of Africa. We want to interact with the rest of the world, the youth movement of the other groups, be present in their conferences, make presentations, and also possibly get ourselves involved in exchange programs. This would affect the other young physicians across Africa and give us a sense of belonging, and I'm sure that will drive us further ahead.
With Afriwon, this is one place I feel that we can raise the vision, and the vision of making awareness of young doctors, making a change within Africa, and be able to see if we can be able to actually influence policies that will favor people coming into being more academic, doing more research. I mean, look at the conference we had today. The slots of presentations by Africa so small. We have the fewest slots, but at least there were a lot more African doctors present. So maybe this will really motivate us to do more.
The new challenges for the Afriwon Renaissance are to be able to present the whole Africa, in the world conferences and regional conferences and even local conferences.
My vision for Afriwon is to motivate other young family physicians, get them aware about this group, let them be aware of Wonca and the opportunities that are available, and foster collaboration with other young doctors' movements in other regions of the world. I believe this will help the long way to encourage people to participate more in research and academics in family medicine. It will also help our practice a lot, be able to connect with the rest of the world. Then technology is something I'm very much interested in and passionate about, and I hope to be able to help and motivate other young people to become aware of what's available with technology in medicine and how one can use technology to collaborate with the rest of the world to get more education and to help patients.
For Afriwon, that is a chance for us, that is also an opportunity. The challenge is big. It is to bring all the African young general practitioners together behind the vision to perform our health system and take better care of our patient. So me, I will be in charge of my country and also for the Francophone Africa, how to bring them together, and that is what I will do when I'll be back.
Yeah, well, we hope to organize, to be part of pre-conferences, workshops, and try to launch ourselves in a bigger, larger role. That's to bring ourselves bring ourselves out. We need to make an impact in areas that has to do with youths. Prevention, HIV prevention in Africa is a big issue. We think that other programs that tie around youth programs should actually be championed by Afriwon. Apart from that, GPs need to come together and rub their minds, young GPs to rub their minds together on challenges of practice. Challenging practice, there are a lot of new challenges that we face every day. These can be forums to discussion.
You are in a very lucky position to have selected this discipline, primary care, and I'm quite sure that you are the ones that can make things change. We really need the enthusiasm of the young people, of the new generation, to bring the wall down and to try to communicate more, to try to collaborate more, and to change the primary care and even the world.
What I can encourage the young African doctors to do is to work on communication, to communicate with each other a lot and try to break down the barriers between different health systems in different countries. And I guess again, the thing I can emphasise the most is you need really good communication in order to make a young doctors movement work, but we can change primary care if we try.
Well, say hi to all of them. I think they must be a very good work, and I invite to know us and to join us in this conference. Thank you.
Yeah, Africa is, I think many African countries already have good models of family practice, and I've seen many good papers. We also run a journal, and we receive several papers from African countries, and which are of very good quality. So those people who are already involved are doing good work. I think medical students and young doctors should, very carefully listen to their senior colleagues and participate and, get into family medicine. It's very good. It's for the future of Africa and for the whole world.